that news story there that Bronson apparently will not be.
Good evening, everyone. Welcome. Thank you so much for joining us for this insightful and fascinating talk on a topic that we've not really looked at here at the Hindu Life program before, at least not in detail, and that is integrative medicine and holistic health and wellness. In the past, we've explored certain aspects of this, particularly yoga practice, pranayam, Ayurveda, and we'll continue to do that. But tonight we're going to switch gears a little bit and zoom out, as it were, and take a kind of a bigger picture look at really the paradigm of integrative medicine in general, and also specifically where this may intersect or draw from kind of traditional Indian wisdom texts and teachings. So we are also streaming live on YouTube, and the recording will be available on YouTube. We're so happy that you've joined us this evening. And I just want to say a few words to introduce our guest speaker, and then I will hand it over to her. So we are so honored and delighted to have with us not only a wonderful practitioner and educator, but also a dear member of our very own local community and a great supporter of the Hindu Life program for years now. My dear friend Priti Tandon is a practicing PA, or physician's assistant, who is licensed in both New Jersey and Pennsylvania and has been practicing here for almost 20 years. She is a graduate from the Rutgers School of Health-Related Professions, and prior to that is also a graduate of GS Medical College and KEM Hospital in Mumbai, India. With Priti's diverse clinical experience working in different clinical settings, she has now developed her own expertise in this area of integrating the best of the East and the West, so to speak. Particularly right now, her focus is in the management of pain, anxiety, PTSD, and addressing pain management in the context of cancer, among other areas. Priti is particularly focused on medicinal marijuana right now, and I think that's something that she might speak to a little bit in the presentation when she talks a little bit about herbal medicine. And in this work, in her practice, she draws from, again, both Eastern and Western modalities and paradigms, really to kind of to integrate them and to present a holistic picture of addressing pain, discomfort, and suffering on physical, mental, and emotional levels. Priti draws also from her own personal and deep experience in and practice of yoga, asana, meditation, and Ayurveda. And she offers this to her patients to help them to achieve levels of optimum physical, mental, emotional, and even spiritual health with this integrative approach. She's currently offering phone and Zoom video consults, especially in this time of the pandemic and quarantine. And we're just so delighted and grateful to have her with us, sharing of her time and wisdom. So I know everyone's muted out, but please join me in giving her a very warm Princeton University welcome.
Thank you, Vineet, for such a wonderful introduction. And I really feel so privileged to be a part of this community and to be able to present. I'm going to just start off with a short prayer, which most of us are familiar with in our practice. If you want, just since we are mostly, I think all of us are at home in a comfortable place, so finding that comfortable spot, whether seated or laying down, whatever is most comfortable. We'll just invite you to just close our eyes and take a nice, deep, relaxed, cleansing breath in. And breathing out. Sahana bhavatu, Sahanau bhunaktu, Sahaviryam karvavahahi, Tejasvinavadhitamastu ma vidvishavahahi. Om Shanti Shanti Shanti. I'm going to start by sharing the slides. Is everybody able to see those slides? Yeah?
Yes, we are.
Okay, thank you. So this is talking about integrated medicine, which is comprehensive medicine, as I would call it. My goal today is to really, present this comprehensive picture here, and to bring into the light this Eastern Western medicine, bringing it so Eastern medicine, which is based on the holistic approach, or the, as you were, the term holy, or the spiritual part of it, and the Western, which is the allopathic medicine, which includes, prescription medications, surgical interventions. So we're really trying to incorporate and bring this together. So my goal today is really, in this presentation, if I can reach to each of our participants and really have them tap into our inner strengths and our inner sense of well-being, and learning and integrating this Western and Eastern medicine to tap into that innate capacity to heal ourselves. And that is what the purpose is. So Eastern and Western medicine, which is the natural Ayurvedic herbal medicine, which is the intuitive part, complementing with the allopathic medicine, which is pharmaceutical and scientific based medicine. So if I can reach and empower with our realization of our innate capacity to heal ourselves, I feel like a lot of my work will be done. So, trying to understand that concept of integrated medicine. Conventional allopathic medicines are based a lot on the prescription pills, and really treating each organ part and a specific system, while bringing that Eastern, which is based on preventative medicine before the crises occur, is really treating the person as a whole, as a human being, as which is the mind, body, spirit component of it. So health is a state of balance and an equilibrium, which is the bodily system and functions which integrate with each other to get that. And it also includes the environment, so that the state of well-being and health is achieved. So we are able to keep our immunity strong and our defense mechanism strong to protect ourselves. And specifically now with this COVID, and our immunity really counts in that. And of course, the role of nutrition is an important aspect in it as well. So as integrated medicine is the mind body, which is, based on the belief system, which is the intuitive part of our being, in addition to the physical part of our being as well. So there is a big impact of the nervous, the psychological, and the spiritual component in this. So holistic health, it really comes from the word holy, which is again based on the belief system, and how it differs from allopathic medicine, as I had mentioned, is treating each organ part versus the person as a whole. So health is not merely an absence of disease, but a mind, body, spirit, which is at ease. So any kind of illness brings us that state of disease. So again, healing is considered as a part of this integrated approach versus management of a disease, which is very different from the Western medicine, where we manage the disease, we manage the specific symptoms, and a lot of it is really suppressing. In our traditional Western medicine, in order to for us to see the pain, the grief is very hard as human beings. So in traditional medicine, we find prescriptions, especially with pain, and now we have the opiate, which became an opiate crisis, to suppress that pain. But in order for us to really lose that fear of pain and to be able to express our, selves, and to really experience that pain without fear, and overcoming that fear is the goal. And sometimes we just have to go through the crisis, and we are seeing that in this present day and age with the last 3-4 months of this crisis that we are experiencing globally, and a lot of us are just shaken by this whole experience on why did it happen and how. But it had been a learning experience. So sometimes the cycle of life, we have to go through these cycles of crisis in order to recover from it. So and as I'll go and talk further, some of these practices actually work on the symptoms getting worse before they get better. So pretty much this is talking about the state of health. And again, there are a lot of slides, so don't be alarmed with all this information. It is a lot of information, and I don't want to stress you guys out. So if you're welcome to use these slides later. I just want to express my own experiences with it, being a provider, having been trained in allopathic medicine, and being very, very blessed, and having the privilege of the heritage where I grew up in a tradition, the Hindu tradition of yoga meditation. My grandmother was a meditator, and I learned that from my father. And this whole, even our foods, we were in a vegetarian family, and our foods and our lifestyle kind of integrated. So even though I learned allopathic medicine, this part of Eastern concept was always there. So over the period of years of 16, 17 years practicing as a PN, prior to that practicing as a physician, I have learned that there is a limitation to the Western medicine. And although traditional medicine has a big, huge role, which is so based on evidence and all the new technologies, and which is very, very important part of medicine, but we tend to forget this part of ourselves, and we kind of rely so much, and we almost feel weak with our own immunity, and we feel like medications, in this case antibiotics or any of these, which actually end up causing more harm. We tend to rely on that a lot as well. So this all comprehensive health is really including this aspect of it, which includes the diet, using food as medicine, and having supplements, exercise, mental, physical, spiritual, relationship health, and all those aspects are pretty important in this all as well. I'm going to touch on a specific groups of specialty and based on the Eastern tradition, and this is going to be a very brief touch up. So obviously some of you have some information on it, and there are resources that I have links to that if you want to read up after. So one of the things I'm going to start off with is acupuncture, which is on the belief that health is determined by a balanced flow of chi, which is considered the energy source, which is circulating in the 12 major energy pathways, which are called the meridians. And they are specifically linked to every internal organ. So, it's really almost like an electric current, which is flowing, and they are all so well interconnected in every part of our body. And each meridian, and I'm actually going to show that diagram, and we'll show, and it's a very busy diagram, so it's hard to see, but each point actually relates to an internal organ. So the acupuncture technique, which the traditional Chinese medicine includes, and acupressure, works on specifically working, with the internal organs, and helps to ease the symptoms in them as well. Similarly, Ayurveda, which is the called science of life, it is based on constitution, which is the keystone in Ayurvedic medicine. So overall, the health profile, which is a balance of strength and susceptibility, the 5 basic elements, which are, ether, space, fire, air, water, and earth. And then they are combining the 3 doshas in it, Vata, Pitta, Kapha. The Vata is the ether, space, and air. The Pitta is fire and water, and Kapha, which is the water and earth element. Any disturbance in these 3 doshas can cause sickness and susceptibility to outside stressors. So Ayurveda defines health as soundness and balance among body, mind, and spirit, and an equilibrium in these doshas. So and there are, again, in Ayurveda as well, herbal remedies that are there. So what it incorporates are these 4 major components, which is the cleansing or detoxification. Panchakarma is one of them. Of course, fasting is another form of cleansing. This is way to remove the toxins from the body. The balance and passivity of the doshas are focused on, and then the spiritual dimension is focused on in as well, and the role of herbs, fasting, chanting, yoga, meditation, and lying in the sun. The sun bathing is an important aspect of it as well. Rejuvenation and detoxification, which enhance the body's innate ability to function, and it's kind of like a physiological tune-up. The mental hygiene is very much focused on, and the spiritual healing from it, and the role of meditation, the prayers, prayers mainly for grace. That is a huge role in this, and the subtle energy from collective prayers is very much focused on in Ayurvedic healing. The forms of meditation, as we are all familiar with, the mantra meditation, which is using the sound therapy, and it changes the vibratory patterns of the mind. The yantra, which is the concentration on the geometric patterns, and the tantra, which is the direct energy through the body. So they work on the altered state of consciousness, which is having its, they also use the metals and gems, which have their healing properties as well. So the treatment in Ayurveda involves the diet, and we do know some of the Ayurvedic cooking. Traditionally growing up in the Indian, we are familiar with turmeric or cloves having their medicinal anti-inflammatory property, and they are traditionally used as, food as medicine in the Ayurvedic cooking. Part of exercise in form of yoga is an important element as well. Just skipping on through the slide. Massage, which is the Ayurvedic massage, and as we talked about, the sun's bathing. Moving on to homeopathy, which is the dilution of natural substances from plant, animals, and minerals. So it based on the concept of like cures like. That means the more the remedy is diluted, the more potent it is. So an illness is specific to an individual. So practitioners of classic homeopathy consults, they use the resources of compounderies called repertoires, and these remedies are closely matched with the total picture of a patient's symptoms. And that means they are really treating the person as a whole, and they are sometimes the symptoms actually get worse. So this is known as the healing crisis and Heron's law of cure. So at stages of homeopathic healing, the progress, as they progress, the patients may get worse with their symptoms before they actually start getting better. The long-term benefits of homeopathy in a patient is that it not only alleviates a symptom, but it reestablishes an internal order, and it cures at a deepest level. So they actually use the term cure in homeopathy. Naturopathic medicine is also a form of, it's actually based on the American Indian tradition, where the natural healing power of nature, again, here as well, the use of herbs, being in nature as a healer, and they focus a lot on preventative part of it. So they treat the disease by utilizing the body's innate ability to heal itself. And the naturopathic physicians, and there are actually some training schools in the country. I think one of them is in Arizona, which is a certification degree course of naturopathic medicine. They do incorporate variety of treatment medicines, which are based on individuals' diet, the lifestyle, and their work and personal history is taken into consideration as well. And here the physician or the naturopathic physician is considered as more of a teacher, and they work, of course, on the preventative part of it. So the signs of symptoms are seen as a manifestations of body's attempt to naturally heal itself. And the WHO definition is a state of complete physical, mental, and social well-being, not merely an absence of disease. This is just a little herbal garden, which is an important part of the naturopathic medicine, using the herbs. These are kind of busy slides and they're very hard to read, but I'm not going to go too much into it. I wouldn't worry too much about it. And if you are, these will be available, because these are the different forms of herbs and how they act on different parts of the body. Some examples that we probably know, quite a few of them are common: aloe vera, bilberry, cayenne pepper, chamomile. We use them as teas sometimes, of course, ginger, garlic, and a lot of the turmeric, which we have used in the Ayurvedic cooking as well. Little herb garden that I always have every summer. Another important part of natural medicine is the nutritional aspect of medicine. So food as medicine, knowing these 8 amino acids, 13 vitamins, 15 minerals, fatty acids, antioxidants, role of bioflavonoids. Example of these are in carotens. We have the glutathione, the antioxidants from the cysteine, methionine. And again, I don't want you to recall all these, there are too many technical terms, don't be carried into this. Important thing to remember is the micronutrients. We base our nutrition on, the basic vitamins, and we talk about the foods, the carbohydrates, proteins, but we do tend to forget those micronutrients which have the antioxidative effect: CoQ10, NADH, copper, magnesium, selenium, chromium. These are pretty important as well. I'm going to skip through these slides, the normal natural hormone replacement, because they can get very technical. So I'm just going to move through. Prolotherapy is, again, what the only concept in this that I want to bring about, and which we have now seen specifically in case of COVID, is the PRP, which is the patients who have already healed from COVID and have developed antibodies. Their plasma is spinned out, and the platelets from the plasma are re-injected to stimulate the patient's own immune response. So these antibodies, which are injected in, actually work to attack the virus and are sent out as soldier cells. So that's one of the part of this therapy, which is the PRP. Talking a little bit about body work, chiropractic, they work mainly along the spine. So their goal is to really, work on manipulation of the spine, so that any blockage in the spinal or the cranial area is worked on. So the practice of chiropractors are working on the relationship between the structure of the spine and the function coordinated by the nervous system, and how the relationship affects the preservation and restoration. So any impingement of the nerve can cause this pain. So this alignment of the chiropractors do of the spine, that allows this flow of energy, what they call as a dis-ease is the subluxation and impingement. So through the manipulation, they are able to repair that alignment. Osteopaths, which are also very similar to chiropractic, the only difference is that they do work on body energy, and these are DOs. They specifically, they believe in the form of physical medicine that helps to restore the structural balance of the musculoskeletal system. That means combining the joint manipulation. Part of it is physical therapy, postural re-education, and its effect in treating the spine and joint difficulties, specifically for arthritis and digestive disorders. Craniosacral therapy is, these are some forms of osteopathic manipulation, just general mobilization, functional position release, muscle energy, and part of that is craniosacral energy. So in the craniosacral therapy, it's believed that just like we have the cardiovascular rhythm, we have the respiratory rhythm, we also have a craniosacral rhythm. So the cardiovascular, you have a pulse rate of anywhere from 60 to 80, the respiratory rate is 12 to 16. Craniosacral rhythm is generally 10 to 12. It's literally a rhythm with which the cerebrospinal fluid flows through your cranium into the through the sacrum. So there is any kind of blockage in this causes an obstruction. And craniosacral is very subtle energy, very much similar to Reiki, and it helps to bring that balance in the flow of cranium sacral as well. Massage therapy is another important part of it. I'm going to skip through the longevity and anti-aging medicine. The important aspect that I wanted to bring into mind is the mind-body medicine, which is bringing in the psychological, the social, and the anthropological components of it. So mind-body medicine is revolutionizing modern healthcare, recognizing the profound interconnection of the mind and body. The mind and body have an innate healing capacity, as we talked about, but the important part is the moods and the attitudes and the belief which are virtually affecting and causing the chronic illness. So fear, cynicism, pessimism, hopelessness, helplessness can be detrimental versus, having the courage, the good mood, sense of humor, hopefulness, and optimism can be all very beneficial in this. And the different aspects of mind-body medicine, which uses a lot of psychology and the psychoimmunology part of it. That means the psychology affecting the immunology, the immune system as well. So the role of endorphins, the peptides, which is an important role in health. So each part in this mind-body medicine, each person is treated as unique, and the different modalities of treatment that are used in this are, dealing with the chronic stress. So, working with the patient-provider relationship. So we work with the system approach of human influenced by environmental factors, relationship dynamics, and the role of therapeutic touch, and massage therapy is a part of it as well. We also have the health part of the grief, bereavement, which is an important aspect. Mental health component of it is played on, and then play therapy, faith, and prayers is an important aspect in that as well. Sharing and support, which, we belonging a part of the community is an important part, and staying connected. The connectedness is an important aspects in this mind-body healing aspect of it. Some of the therapeutic approaches here are using the guided imagery, and I am going to actually get into that. So if we are kind of bored listening and looking at all these, I'm going to skip through that, and we're just going to do a small guided imagery meditation practice. So finding yourself in a comfortable position, if you want to skip through all that. So either a seated or a laying down position, find yourself a comfortable position. If you want to close your eyes, so get comfortable, either lying down or sitting up, taking a few breaths. Begin to imagine that each in-breath you take in calmness and peacefulness. With each out-breath, you release tension, discomfort, and worry. Let your breath find your own natural rate and rhythm, and continue to imagine breathing in calmness and peacefulness, breathing out tension and worry. Invite your body to relax. Imagine breathing calmness into your feet and legs. Release any tension on the out breath. Breathe into your pelvis, hips, and low back. And release on the out breath. Don't struggle or make an effort. Just imagine this happening in your own way. Breathe calmness into your abdomen and release tension on the out breath. Breathe into the chest and release tension as you exhale. Breathe peacefully into your neck and shoulders and release tension as you exhale. Breathe calmness into your arms and hands and all the way to the fingertips. And relax as you let go of the breath. Breathe into your face and jaw, into your scalp and forehead, into your eyes, and release all tension. Allow your whole body to sink into a peaceful, relaxed state. Now imagine yourself in a place that is particularly peaceful and beautiful. Perhaps a place you've actually visited or a place imagined. A special place you've really like to be. Imagine yourself there now and notice the details, what you see, the colors, the shapes, living things. Notice what you hear in this special space. Smell any aroma or odors you associate with this place. Pay special attention to any feelings of peacefulness and relaxation that you feel, and allow yourself to experience them as fully as possible. Whenever you're ready, simply allow those images to fade gently and open your eyes. So at this stage in our period of life, we are experiencing a form of rebirth which is based on our ancestral teachings. We are kind of going back into our older teaching, going back to what we've always known and we've sort of forgotten amongst all this chaos, um, and reaching to the new normal, as we are now calling it. Underneath all these layers of self defenses based on fears, insecurities, envy, anger, division, there is only love. From destruction comes restoration, and evidence of divinity exists in our connection to one another. With that, I close this talk and I'm opening this out to questions. You might need to unmute yourself, Beneath. I can't hear you. Okay.
I'm sorry, can you hear me now?
Yeah.
Okay, sorry about that. Priti, thank you so much. That was just, really kind of powerful overview. As you said, I think there's a lot of information there, and sometimes a lot of information can feel really kind of overwhelming and daunting. I'm wondering if you could maybe speak just briefly to kind of what is the one or maybe one, two, three kind of threads that ties us all together? Because sometimes we look at all of these different, modalities and methods, and we think like where to start. Like, okay, there's value in this, there's value in that. Maybe I should try that. And for some of us, I think that can turn into a tendency to dabble.
Mm-hmm.
To dabble kind of superficially in a lot of different things.
Mm-hmm.
And like today it's osteo, and tomorrow it's herbal, and the next day it's very like diet based. And
Mm-hmm.
so I don't know if this is a fair question, but in your experience in trying to understand this kind of in an integrated way, what would you say is like the one or two or maybe at most three threads that kind of tie these different things that you've talked about together?
I think it is all very much individual based. So, every person, all this information that I presented, and, all of it may not work for every person. So, traditionally, whatever has been a comfortable, some of us may have a yoga practice, some of us may have a meditation practice, some of us may just be focusing on the nutrition component of it. So, if we are able to just tap into that on our daily, keeping a routine which is not very, a discipline is an important aspect of it. And yes, the meditation teachers, wherever I have been a practitioner of meditation and yoga, but having that discipline of at least a 10 minutes or at least a 5 minutes of practice is an important thing that teachers always stress on. So we can have that kind of a discipline. And even if we can take a few of these components and keep it together on a regular basis, because most of these modalities of treatment are a cumulative effect. So you're not going to see the effect. You go to a chiropractor today and you're feeling better and you're completely cured. Same thing with having natural herbs. You're taking it one day and you're just, there is a role for Tylenol or Motrin when you're having a headache. But all these modalities are really to prevent those headaches, those chronic ailment, the chronic stress, which is leading to inflammation, which is leading to cancer, which is, all these. And Western medicine has been so much geared by pharmaceutical companies that, not much stress is laid on preventative part of it. So my goal here is to really empower us to understand that preventative component. We don't have to go to this. We don't have to, if we got a little cold, we don't have to go running to get an antibiotic. We don't have to go, causing the chronic stress. We can choose foods, we can choose lifestyles that are going to reduce that amount of stress and reduce our cost for inflammation, and which steers towards chronic illnesses, including cancer, including cardiovascular diseases, including stroke. and that kind of thing. So that is one thing that I would just stress on. Even if there is so much information, you may not be able to pick each one of them, but if you just keep that common principle in mind, that this is what our goal is, to, the optimum health is preventative, and being aware of what the stresses are, and just the mindfulness part of it, I think, is very helpful. Does that answer your question, Vineet?
Yes, yeah, thank you. Thank you so much. We've got a couple of other questions, and some of these are being sent to me sort of privately in the chat box. So I'm happy to ask on the questioner's behalf if they're feeling a little shy. And so two questions came in. To what extent, so this is the first question, to what extent might we consider mind-body techniques like guided imagery, meditations, even sort of the so-called psychic healings? To what extent are we seeing that these are actually used in hospital and healthcare settings? If you
Yes,
have any knowledge about that.
Interestingly, the hospital settings are now getting more aware of bringing that into. I know my experience has been, in the crisis management has not been so much, but I know this much at Robert Wood Johnson itself, even in Capitol Health, which are the local hospitals nearby. People have started just doing courses and classes on mindfulness. There is a role for movement and yoga and stretching, and me with my being in the practice have always, the breathing part of it has been brought into, just teaching the patients to just breathe and learn to relax with that has been brought in. But yet, there are a lot of hurdles in this with the insurances coverage. And, I myself right now work in cannabis, which is, I considered herbal medicine. But, there are a lot of hurdles with that as well. Insurances are not covering it. And the THC component of the cannabis has the psychedelic effect, and it's addictive, experience with that. So there are a few hurdles, but I think slowly and surely understanding the limitations of allopathic medicine, I think it is, people are becoming more aware of it, and people are becoming more, um, you know, um, mindful and preventative in this, and especially the younger populations. I see they are kind of aware, and they are working more on preventative health.
Yeah, thank you. A second question that came in is, how can we, identify genuine wellness products, things such as like Ayurvedic medicine. Um, and I'm going to like kind of flesh out this question a little bit, or add a little bit of my own, in that, sometimes there's some concern also, because if in some ways this is a quote unquote unregulated,
Yeah.
kind of, the marketplace, so to speak, is unregulated with these products. Do you have any kind of practical advice for discerning kind of genuine, trustworthy products from others that maybe you would say kind of like raise some flags for you?
Yes, so there is actually, and I'm trying to find that while I had a link. When I attended the AAPA lecture, there was a physician who had presented, and I'm looking to my phone, there is a link specifically for herbal supplementary prescriptions that are over the counter. And I just, it's called I have to find it right now. Consumer products. It's the consumer products as a website for it. Can I send this out to the link if I don't remember it right away? Because I'm trying to find it and I'm not able to, but I have those links, those resources that I can link, and I can just send it out to
Sure,
whoever.
Priti, why don't you send that to me, and
Yes,
and then I'll go
I
ahead
will
and share it,
definitely do that.
widely with the
Yes,
community.
absolutely.
We've got a little bit more time if anyone has any questions, comments, and you can feel free to unmute yourselves and ask directly, or if you'd like to ask in the chat box. And yeah, I see here's a question in the chat box. Is there a particular brand of CBD products that you would recommend for pain management? The sheer number of them, as one of our participants is saying, the sheer number of them is quite overwhelming. And it seems like these days everyone is selling them. They're quite expensive. It's quite an investment. So do you have any kind of practical guidance on CBD products?
Okay, so in order to find the CBD products that have very little THC, you want something which has less than 0.3 THC, are available over the counter. There is some that I know in our office uses, is called the Joy. If I can find that, one is called Joy, and the again, these are some things I'm going to have to actually look in because they're not coming in top of it. And I'm going to put a note on all these questions that I have, and I can send them out as link. I definitely have those resources, and I'll be happy to share them.
Sure.
Okay.
And I can go ahead and put in that chat box. I believe the company is called Joy Organics.
Yes, Joy Organics is one of them. I know today there was a patient that told me about it, another company. The goal here is to really, when you're seeing the CBD, you want to see that the high dose of CBD and the THC is low. And there are different formulations that are available. Some of them are in form of gel caps. There are also in the CBD products itself, they have other components like, for specific, for sleep, sometimes insomnia, those are used, they may have some, actually have a good one over here. This is something I just found. It's like a patch, a CBD patch. La Mend, and it's calm. There are all different parts of it. I mean, this is also $11, but I just found this. I have never used it, but somebody got it, and I had this. So they are available in form of patch. Some of them have different components in it. They help with the sleep. Some help with the anxiety components. Some of these are for muscle relaxant components, so they help with the pain as well. This one, for example, it is the hemp, and it has cannabinoid 15 milligrams. So you want to also see the dose. The higher the dose, it's going to be more helpful, but it's hard to find those really high doses which are not so expensive,
Right. And just to clarify, when you're talking about the dose, you're talking about specifically the CBD dose. You're not talking about THC. You're talking about CBD.
No. These CBD products will hardly have less than 0.3% THC. Yes.
Right.
The only way you're going to get higher level of THC, at least in New Jersey, are the dispensaries, which are by prescription, and of course some states have recreational, include Oregon or Denver or Massachusetts, where they have the higher THC component. Where people get tripped on this is that, they enjoy the psychedelic effect and they just get it like getting stoned or high on this, and they're smoking joints which have really high THC, so 50%, 60% THC, which I think it's kind of scary because it kind of throws people into psychosis, especially patients who have had history of bipolar or they are having any kind of mood disorders. It can be quite dangerous, and they can throw them into psychosis. And that's why the regulation is very, very important.
Right. I should also specify here, and I should have done this probably at the beginning of the talk, but we're presenting this information in the spirit of kind of sharing general principles, and particularly as it may kind of intersect with and connect to kind of general principles of wisdom that are found in ancient Indian tradition, Eastern traditions generally. By no means should this be taken as any kind of, specific directive for anyone. This is not medical or health advice. And, to Priti's point that she made in the presentation, particularly with these modalities and technologies, so much of it is really personalized and individualized. And so please, for those of you listening or listening on YouTube, please keep that in mind, that we're not talking about, go out and do this or purchase that product or whatever. These are sort of general principles that we're speaking about, or general kind of guidance to learn more for yourself.
Yeah, thank you, Vineet. Yes.
Hi there.
Hey, Rajan.
Hello, Rajan.
Vineet and Dr. Priti. My name is Rajan Narayan Swamy. I'm a yoga and meditation teacher It was a wonderful talk. I love the slides. I hope we can have those slides later on, if you don't mind.
Absolutely. I'd be happy to share them. And as I had mentioned to Vineet, that there's a lot of information, and I'm sure I've overwhelmed a lot of the people and lost some of our crowd here. So, absolutely at your convenience, I'm happy to share. There are also some resources that I have used at the end of the slide. So definitely with the group, I'd be happy to share them. However, we want to do that, and I'll coordinate that with you as well.
Good. I had a comment, a personal experience, and also one question. Many years back, I had a chronic acidity, and I used guided imagery to cure it, actually. So this is my personal experience. You must have heard about Martin Rossman's book, famous book it is, and also there are these scripts created by Gerald Epstein for guided imagery. I used these two books and actually cured my acidity. So this is for anybody who is listening. They should definitely try guided imagery, very powerful technique.
Yes.
So I'm glad you brought that out. The second thing is, there is this degree called DO, right, which is equivalent to MD.
That's a DO. You're talking about osteopathic, doctor of osteopathic medicine?
Yeah, correct. So
DO,
what is
yeah.
that actually?
So yeah, that's exactly what I had talked about. Their training is a medical school. There's a school of osteopathic medicine. So their first year of their school course is works on muscle energy. So they work on different more actually for me, because I myself was not trained as a DO, but I have worked with DOs, and I know their training initially starts with this body work, where they work with the craniosacral, they work with the muscle energy, they work with myofascial, and then they eventually branch out to other medical degrees, and then they do their residency program like an MD would. So in effect, they go into different specialties. So I've had ER docs that I've worked who are DOs, and there are family medicine docs that are DOs as well, and they pretty much practice the same way, because eventually when they branch out, medicine in the Western world, it's not, traditionally we had the MDs or physicians or doctors that were practicing medicine. Now in the Western world, it has, at least in America, it is so different, because there are different practitioners of medicine. We have the physician assistant, we have nurse practitioners, we have DOs, MDs. They're all licensed providers, and they're all clinicians who have prescription privileges and pretty much alternately do the same thing. As far as the PAs and nurse practitioners, they don't really have as much independent practice. They're always with the group practice. Although with this COVID, the recent New Jersey state has waived away the supervising physician. So, part of it, so the PAs are actually going to be working more autonomously now. So yeah, there are all these different practitioners. That's why we call ourselves clinicians or advanced practitioners. But yeah, pretty much there's overlap in our roles as clinicians here.
Thank you.
Thanks. So we're almost at the end of our time. One sort of final question. There's a couple of questions that we unfortunately didn't get time to address, but one final question is kind of switching gears a little bit. How would you address some of the pushback against some of these modalities? The kind of like stigma around whether it's herbal medicines. In the case of medicinal marijuana, obviously there's a lot of stigmas and a lot of assumption that kind of conflates recreational marijuana use and drug use with sort of the kind of medicinal, uses that you're talking about. And so, sometimes there can be a kind of a stigma against some of this stuff that even within communities like the Hindu community, where so many of these modalities come from, there's a kind of a sense that this is like superstition or like kind of like witch doctor stuff.
Right.
So just kind of a kind of a quick, like, how do you personally or as a professional respond to some of those, some of those challenges or pushbacks?
Yeah. No, that's a very valid question, because indeed, as a clinician and as a licensed provider, we do practice evidence-based medicine. So a lot of these herbs, they really don't have evidence. So in my practice, I've always been extra careful to ask the patients if they are on herbs, they say they are interacting with their prescription medicine. That is a big challenge because some of these patients may be just taking these herbs on their own and we don't know they're interacting with the medication. As far as cannabis is concerned, yes, there is a lot of ignorance in the medical community and it is still work in progress. And indeed, there is a lot of taboo, especially with the THC component of it. And, the laws, are very much subject to the DUIs for people who are driving and in the state, and every state is different with that. The federal laws have actually been more lenient, but it's states, every state is more differently regulated, so definitely there is a lot of room for education on this. I am actually going to be doing a certification course and I have done some online. We missed out on my boss and I, we were going to go for a 3-day seminar on cannabis education. And because of this COVID, we didn't do that. And we did some online training as well. But, I think just educating and reducing the ignorance by understanding the pharmacology component of it, the phytocannabinoids, how they work, and each component, I think that there's a lot of room for knowledge in that. And again, this is all very new, so there's very little evidence now. More of it is the subjective experience of the patients, because I'm working with patients, I have seen a whole lot of results where patients who've been on heavy duty opioids have been able to get off, especially patients who've been suffering from alcohol abuse have been able to get off just being on marijuana. I've seen pretty good results with it. So again, there are pushbacks, yes, because traditional physicians, they all still, look at it with a taboo. So there is a lot of ignorance about it. And our role here is to educate and bring more awareness of it and learning the specific strains and understanding each strain being different and how much is CBD component. It's a whole lot. And when I see my patients in my position, collaborating physician as well, we really tailor to our patients and we monitor them really carefully. We discuss the strains, we talk to them on how to take the edible forms, which is smoking, vaping, with all those injuries as well. Those are kind of very valid things that need to be addressed in this, surely.
Great. Well, thank you again so much for joining us, and thank you all for joining us on this Wednesday evening. Please do stay tuned for more Hindu Life programming. We've got a couple of more programs coming up, and then we do go on a brief hiatus for part of the summer, and then we'll be back later in the summer and of course in the fall. But we're not done yet, so stay tuned. If you are getting emails from us, wonderful. Look out for those emails. If for whatever reason you are not receiving Hindu Life program emails, perhaps you've come to this program in some other way and would like to learn more about the program, if you would just do me a favor and take a moment or two to include your email address in the chat or send me a private chat with your email address, I will be more than happy to add you to our list. But again, I want to thank our guest speaker this evening, Priti, for sharing. I know there was a lot of content and she did a great job in giving us a nice overview and also hitting some specific points. So I'm very appreciative of that. And hopefully we can return to the video on YouTube, and we'll make the PowerPoint available to everyone to take a deeper dive into some sections that we didn't get a chance to get to together. Thank you all so much, and have a wonderful evening and a wonderful rest of your week.
Thank you, Vineet.
Thanks. Take care, everyone.